Our healthcare practice is one of our core practice groups. We're the only core practice group that's focused on a specific industry, in the healthcare industry. We have 20 plus lawyers that are currently in the group, and we practice all across the spectrum of healthcare businesses, including providers. They are involved in healthcare in some form or fashion. From a business perspective, we probably represent them. And it's a dynamic practice. As you know, healthcare is a very significant part of the economy, and it certainly drives a lot of business opportunity. It's a really, really great place to be just in terms of the activity and the growth opportunities that we're seeing. I would say the key way that we differentiate ourselves from our competitors specifically is if you looked at our roster and the folks that are part of our group, especially at the senior level and even down to some of our associates, we all have some form of industry experience. We've either worked in-house, we've worked in the industry itself. We have several of our attorneys who are currently registered nurses, for example, and they maintain licenses. And we have a former licensed nursing home administrator. We have several folks who are out of government. And I think that gives us a very unique perspective when we have that industry background and that industry experience. And it really drives a passion amongst our practitioners to stay involved in the industry at a level that really brings value to our clients because we know what they're going through. We've been there. We help our clients figure out some of the most complex problems in healthcare, and it really allows us to differentiate ourselves. One of the biggest areas within our practice group is in the mergers and acquisitions and transactional side. We do a lot of deal work. A lot of it is driven by private equity and family offices that are looking to invest in companies and invest in healthcare. We've been very fortunate that a lot of our work on platform type acquisitions has then turned into recurring add-on transactional work and then ongoing just regulatory work on behalf of these clients once they acquire their businesses and put them in their portfolios. We do strategic deals as well. The deal work is a big part of almost everybody in our group has some piece of their practices in the transactional side. The other areas we have, obviously, because it's a regulated industry, virtually everybody in our group deals with regulatory issues and how those either impact day-to-day operations and or even structuring and executing on transactions. Often we have to navigate around specific regulations that require us to structure transactions in a certain way. And then another piece is really the advocacy side of things, and we're fortunate enough to have several former government lawyers, prosecutors, and we now defend and have a white-collar practice where we defend and help clients navigate compliance issues, very complex compliance issues and responses to audits, subpoenas, and unfortunately at times defending them in front of the government or other parties that are seeking to recover monies for some alleged wrongdoing. So we really have all three of those areas are very active and continue to be very, very robust from a growth perspective. We have a fairly robust practice in dental service organizations, and we team up with our corporate group quite a bit on those transactions and representations. Those are just examples. Again, every day it's something new and different. We have a very strong post-acute practice, care and hospice, but that also deals with senior living and nursing homes. And that was kind of the historical DNA of the practice at Benesch, was really focused in the long-term care area, senior care, post-acute space. And over time, we've certainly expanded it and now do a lot in the acute space with hospitals and health systems, physicians, physician organizations, and the like. And we represent a lot of dialysis providers as an area of a niche that we have a good foothold in addition to dental. Behavioral health is very active right now. There's a lot of expansion in terms of coverage under certain regulatory or reimbursement schemes, Medicaid specifically. So it's driven a lot of interest and activity in the behavioral health space that we do a lot of. So it's really virtually any, as I said, any business that touches the healthcare industry, we've probably represented them in some form or fashion.